Hello everyone, I'm Dr. Lim from KB Lim Skin Clinic. Today I'm going to talk to you about vitamin D. Now you might wonder why a dermatologist would want to talk about vitamin D, but the reason may become clear as I continue my presentation. So, as a dermatologist, we see the consequences of sun exposure. First, the cosmetic complication, medical complications as well. So, photoageing, sun-induced aging, and that's a consequence of chronic exposure to the sun, and it may present as wrinkles, severe wrinkling, or the appearance of lentigines or age spots. Then we have the medical complications in the form of cancers. So here you can see a patient with severe wrinkling and lentigines or age spots, those pigmented blotches on the near the temples, and all these are the cosmetic consequences of chronic sunlight exposure or ultraviolet light exposure. And then the medical complications include different types of skin cancers. On the top left, basal cell carcinoma. On the top right, squamous cell carcinoma. And in the bottom of the slide, the dreaded melanoma, which is potentially fatal. And a third consequence, it's not a direct consequence, is patients with melasma or chloasma or hormonal pigmentation, also known as the mass of pregnancy, is melasma gets very much worse with sun exposure. So my role, or rather a dermatologist's role, is actually to tell patients to avoid sun exposure for the reasons that we mentioned. Avoid the cosmetic complications, the wrinkling and the lentigines or age spots. You avoid skin cancer, and what we want to do is avoid worsening of melasma. Melasma is a very common problem in Asians, and it is very disturbing, especially to Asian women. And a lot of women will have all sorts of treatments, expensive treatments, and to see the melasma get worse is something that's not quite easy to tolerate for these patients. So our role as dermatologists always is to say that you want to avoid the sun, you need to use physical protection, you need to use sunblocks, and so on and so forth. So the dermatologist's recommendations usually are reduce exposure to sunlight. You can do this by using physical protection. You can avoid the sun by not going out during the peak hours of sun when the sun is most intense, depending on where you are, maybe from 11 a.m. to 3 p.m. or from 10 a.m. to 4 p.m. And the religious and consistent use of sunscreens. All these will prevent some of the cosmetic complications and the skin cancers and melanomas associated with sun exposure. Now, the Australian Cancer Council come up with a very catchy phrase, slip, slop and slap in 1981. Slip meaning slip on protective clothing. Slop meaning slop on a good sunblock, a broad spectrum sunblock depending on activity. A water resistant one would be better. And to slap on a hat. So these are all the protective measures that you can take, and this has been shown to reduce the risk of particularly because the risk of skin cancer melanoma is very high in Australia because of the light skin type and the strong sun that they are exposed to. So this definitely has been a very successful campaign, and this has been now expanded to include seek and slide. Seek meaning seek shade, go under the umbrella or under covers, or to slide on a wraparound sunglasses to protect the areas around the eyes. So this has been very effective. Now back to vitamin D. So what is it about vitamin D? Well, what are vitamins first of all? Vitamins are nutrients that we cannot produce ourselves but required for normal growth and function and development. So they are essential, and we have to take it in our diet usually. In the case of vitamin D can be obtained in two ways: through exposure to ultraviolet light. And vitamin D can be produced. That's why vitamin D is also called the sunshine vitamin, because it's produced by sunshine or sun exposure. Vitamin D can be also uh, taken in uh, through the food that we eat, or through the taking of supplements. So in this slide, you can see the effect on sunlight. Sunlight triggers the formation of vitamin D. The way it works is sunlight converts 7-dihydroxycholesterol to cholecalciferol, which is also known as vitamin D3. Now, vitamin D3 is then converted to 25-hydroxycholecalciferol by 25-hydroxylase enzyme. 25-hydroxycholecalciferol is also known as calcifidiol. And we can also take, the body can obtain vitamin D from food sources such as milk and from fatty fish. And that is basically provides the body with cholecalciferol or vitamin D3. Note that all these precursors are still not active, and vitamin D to be active has to be converted in the kidneys to 125 dihydroxycholecalciferol or cholecalcitrol or calcitrol. So these are the this is how vitamin D is produced in the body. So note, sunlight acts on 7-DHC, converting it to the other precursors of vitamin D and eventually vitamin D. So sunlight is very important for production of vitamin D in the body, and we can also take vitamin D in the diet. Now, the problem with ultraviolet light is, yes, ultraviolet light is good. Ultraviolet B light, which is also known as sunburn rays, because it causes sunburns. It's bad to get sunburned, but it's good because it helps your skin make vitamin D. Then in sunlight, you also have longer wave ultraviolet light, known as ultraviolet A. They are known as tanning rays because they produce the tan, but which a lot of people consider to be healthy, but which is anything but. And it also increases the risk of premature skin aging and skin cancer. So we want to avoid, in terms of health of the skin, we want to avoid both UVB and UVA. Now, a lot of people think that sunbathing under glass might be healthy. Glass blocks UVB, but it allows UVA to pass through. So UVA goes through and it will still cause premature skin aging and skin cancer. Plus, if you use glass to block off UVB, you won't make any vitamin D, because vitamin D production is induced, triggered by ultraviolet B. So this is something that you have to understand for people who want to have a tan and want to go under glass. Now, what are the benefits of vitamin D? It is important. So as a dermatologist, we try to make the skin healthy, but we also want to make the person's body healthy as well. So we think in terms of internal health as well, and we think in terms of healthy bones as well. Now, vitamin D, as we all know, is very good. It's necessary for healthy bones. But what is less known is it also has a positive effect on immune health. In fact, vitamin D receptors can be found in practically every single cell of our body, which means that vitamin D is involved in the body's metabolism in some way. So there are studies that show that vitamin D might inhibit cancer or inhibit the progression of cancer. It might lower the risk of cardiovascular disease and the risk of death from it. It may be involved in brain processes, or lack of vitamin D is involved in brain processes such as multiple sclerosis, depression, and vitamin D has also been linked, low levels been linked with type 2 diabetes. But all this in white are just sort of observational studies where they found a correlation between low vitamin D levels and the disease such as cancer, cardiovascular disease and depression and so on. But this is not considered to be definitive proof, because for definitive proof you have to conduct studies where half the patients are given supplements and the other half are not, and you look at the incidence or the or occurrence of these disorders. Then only can you tell that there is a clear correlation. So this is always a problem in clinical trials. Correlation does not mean causation. That means a low vitamin D is correlated with high risk of cancer or cardiac disease, but it doesn't cause it. The proof is not there. So that's why health authorities do not actually put this as a reason, as a benefit of taking vitamin D, because it has yet to be proven. But you don't have to wait for that to happen. Generally, vitamin D is good for the skin, good for the bones, it's good for immunity. Probably it's good for a lot of body functions, so there's no harm in taking it. Now, what happens when you're deficient in vitamin D? Well, in children, the bones are still developing. They get bowing of bones, as seen in this X-ray picture. In adults, they have a similar condition, but in adults, it doesn't cause bowing. It causes the bones to become brittle. It causes osteomalacia or osteoporosis, where the bones tend to be brittle and breaks easily. So deficiency has a deleterious, a bad effect on bones. That we all know. Now, what are considered adequate levels of vitamin D? Well, the National Institutes of Health say that below 30 nanomoles per liter, that is vitamin D deficiency. Now above 50, or either 50 or more, is considered adequate for bone and overall health. So are you having enough vitamin D? So again, figures from National Institutes of Health, or NIH, if you're age 1 to up to 1 year old, you should be taking in 400 international units. If you're age 1 to 70, it's 600 international units. Above 70, it's 800 international units. Now the thing is, a lot of us are deficient in vitamin D. So it's believed, it is estimated that 50% of the world's population may be lacking vitamin D, and the reason is reduced exposure to the sun, either because of sunscreen, and this is where dermatologists come in, because we say use sunscreen, avoid the sun, stay indoors when you can, use physical protection, or reduce intake. All these are factors that may account for the observed deficiency of vitamin D. Now, vitamin D from ultraviolet light, yes, it does help, and actually you don't need very much sunlight to make vitamin D. Maybe about half an hour exposure once a week is sufficient. The problem is it's very hard to get the right balance. Too little, you get deficient; too much, you get skin cancer or aging. And there are many variables. The skin types affect it, our geographic location affects it. So it's hard to achieve the right combination or the right balance. Now, can we get vitamin D from food? Oh yes, you can take it in cod liver oil. It supplies 1,360. Now remember, for an average adult you need about 600. So this is more than twice the required amount, and it is safe. So you can always take cod liver oil, 1 tablespoon of it. Or oily fish, you have to take quite a bit. Note, in the case of milk, and I mind you, it is not ordinary milk, but fortified milk with vitamin D. 1 cup only produces 120 units. So imagine, to get 600 units, you have to take 6 cups of milk every day, which is rather a lot. I don't think many of us can do that. So here you can see that it is quite hard to achieve levels relying on foods, unless you take a supplement. So the thing is, it is difficult to get the correct dose of sunlight to make vitamin D and avoid the side effects of overexposure. But we feel that you should still use sunblock so that you can enjoy outdoor life safely, and we feel it is better to take vitamin D in food rather than risk sun exposure, premature aging of the skin, and cancers. So this way, we believe as dermatologists, you can have your cake and eat it. So eat vitamin D. I hope you found this video useful, and maybe you understand why we're obsessed with sun avoidance, because it causes a lot of skin problems, cosmetic, skin cancers, and so on. So do visit my website at www.kblinskinclinic.com, where you can read about all these conditions and watch more videos. I'll provide some links below. Goodbye. Take care. Bye bye.